Hi guys, welcome back to the channel. My name is Tunde. Today I just wanted to talk a bit about my pre-registration year, what it is, what I've been doing and just how it's gone so far. It's a bit crazy because I'm 6 months into my year, so that's halfway through, and time literally has just gone so quick. It's been so good so far and I just want to share it with you guys. If you want to know a bit more about what it's like to be a hospital pre-registration pharmacist here in the UK, then stay tuned. For those of you who don't know what the pre-registration year is, if you're going to become a pharmacist in the UK, you firstly have to do a 4-year MPharm degree. After you graduate and complete the degree, you go on to do your pre-registration year. Speaking of graduation actually, for the people who graduated this year, let me know, has your university organised a alternate graduation date for you? Because personally, I haven't walked the stage yet and I want to. So let me know. Yeah, so after you graduate, pre-registration year is kind of like a learning year of training for you to develop the skills to become a competent day one pharmacist. So you can do your pre-registration year in a number of areas. I'm doing mine in hospital, but you can do it in community pharmacy, you can do it at GP practice, there's industrial pharmacy, you can do it at the CCG, and you can also do split placements like half GP, half hospital, or half GP, half community. There's a whole lot of options out there. So most people get their pre-registration placed through Oriel. That's how I got mine. At the beginning of the 4th year of uni, everyone who wants to apply through Oriel does like a set of tests. So there was a situational judgment test, a calculations test, and multiple mini interview station. Basically every student who takes the test gets ranked, and then you rank where you want to do your pre-registration year. Depending on where you get ranked then determines where you get put for your pre-registration year. I'll do another video on the Oriel process another time, so you can look forward to that one. So I chose to do my pre-registration training in a hospital. I chose the hospital I'm at now because I actually did a placement there before, and I enjoyed the people, I enjoyed what I actually did on the placement quite a lot, so I decided let me go back to that hospital for my pre-registration year, and I haven't regretted the decision. So the whole pre-registration year builds you up to take the pre-registration assessment in June of your pre-reg year. To become a qualified pharmacist, you have to pass this pre-registration assessment. The exam is made up of 2 parts. There's a calculations part and a clinical part. It's designed to make sure you have all the skills to be a competent day one pharmacist working independently. So with it being December, there's now 6 months left till this assessment. It's actually coming around so fast. So I think it's time for my revision to start soon. So expect to see a bit more revision content coming your way. So what do you actually do as a pre-registration pharmacist? I only know about hospital pharmacy, so I can only really speak on that. I do short placements in my year in community. I have a 2-week placement in community and a 6-week placement with the CCG. If you want to hear a bit about those placements when I do them, just let me know and I'm sure I can make a video. So over the course of the year, as I've said, the pre-registration year is like a training year where you're a trainee pharmacist. You have a set of performance standards. I think there's 72 of them? 72 or 78. I'm going to go with 72 performance standards. And that could include a range of things, for example, minimizing errors of other people due to effective supervision, handling conflicts appropriately, conducting medication histories from a range of sources, just a whole range of competencies which you have to hit in your day-to-day working as a pharmacist. So when you think you do something, you have to write an evidence on this system called VQ Manager. So you have to write what you did, send it to an evidence witness who saw you do it, so you can't just make things up. And if they agree with the evidence, you then send it to your tutor to sign you off on. So over the year, you have to get multiple evidences for each of these performance standards building to be totally signed off by the time you take the pre-registration exam. So to meet these competencies, you rotate through a number of areas in the hospital and some outside the hospital. We started with a month-long induction, just understanding how to dispense, how to do medication histories, just use this electronic prescribing at the trust I'm at. So just use the system and start our logs. So we had to do medication history logs, ordering, transcribing logs to order medication to the ward, pod checking logs. So that's checking if patients bring their own drugs. You have to check if those drugs are appropriate to be used or not. Dispensing logs. So we had to do 200 items of dispensing logs with no mistakes, and also CD controlled drugs dispensing logs. So far we've done 5 logs, and I still need to do check-in logs. So my first rotation was on the admissions ward. So this was quite a fast-paced rotation. This is where people who go to the emergency department and they need to stay in hospital get put on this ward. It might either be just to stay for a couple of days to monitor them, or just to put them before they get moved to a longer term ward. So there's quite a high turnover of patients. So on this rotation, I was doing medication histories. This is where I was first doing my medication history logs and my transcribing logs, and my pod checking logs. So a patient will come to the ward. So you take the medication history and then you compare that to what's prescribed at the moment. You then have to work out whether if any changes are intentional or unintentional. So for example, if they're regularly taking Ramipril for their blood pressure, but they come into hospital, their blood pressure is very low, say they've been bleeding, and Ramipril is not prescribed, you have to work out, is that an intentional change or is that unintentional change from their medication history? Since their blood pressure is low, you're not going to want to be giving them a blood pressure medicine to further drop their blood pressure, so that would be an intentional change. So you wouldn't bring that up with the doctor to change their medication. If their blood pressure was high, for example, and the Ramipril wasn't prescribed, which is their regular medication, that's looking like an unintentional change. You'd want to bring that up with the doctor to see if they held that for a reason or whether they want to prescribe it. The thing about being a pre-registration pharmacist is you have a lot of support, so it's important to take advantage of all of that. So my next rotation was elderly care. This was a lot slower paced than my admissions rotation in terms of the turnover of patients. However, each patient in elderly care is normally more complex than a patient on the admissions ward, just because many elderly people are more likely to have multiple health problems and are on drugs for their different health problems. So there's just a lot more to go through. Again, this rotation involved doing medication histories, screening the patients and sorting out any problems that I found. But then there comes some challenges on the care of the elderly rotation. For example, a lot of the patients could have dementia or not know what medication they're taking. For example, they might have carers that take the medication, or they might come from a care home. It was a bit harder sometimes to find out what medication people were taking. So you just have to really become a detective sometimes. There's a lot more patients on anticoagulants like warfarin, so you need to confirm their dose. So that can be done by looking at the yellow book, or if they don't have that, you might have to call the anticoagulation clinic and find out the dose, why they're taking this anticoagulant, their last testing, their last test result, when their next test result is. So yeah, you have to find out a lot about people's medication sometimes. So I'm currently on my surgery rotation. So I'd say this is kind of like a mix of admissions, so like a high turnover, and elderly care. So you see a lot of people quite young just coming for a surgery, not on any regular medication. But then you also see a lot of the elderly population come in, might have fractured their hip. They could also be on anticoagulants, a lot of other medication for other conditions, and then that can be quite complex. And then you have to work out if things need to be stopped before surgery, and then how they should be initiated after surgery, just to make sure that patient is getting the best treatment they can before and after their surgery. Also done 2 dispensary rotations now. That's basically when medication is ordered for the ward, it goes to the dispensary, then you have to process that medication request, and give the medication out to the ward. So there are a number of tasks you do as a pre-registration pharmacist consistently. I'd break them down to: firstly, doing medication histories. Secondly, the patients you see to do their medication histories, screen the patient to see if there are any problems. For example, as I've said, look at their blood results, see if anything stands out, see if any new medication needs to be started or any regular medication needs to be stopped. Contacting doctors and prescribers about potential changes to medication. With dispensing, you can dispense controlled drugs, you can dispense normal medication. I'm about to start, I believe, my check-in logs to just make sure the medication is right before it leaves the pharmacy. So 6 months in, I've had a great start to my pre-reg and I've learnt so much. But it's a bit mad how doing a job and doing it day after day, you learn so much more than you could do at university. I plan to keep this going for the next half to the exam, but what I need to add in now is a revision. 6 months to go, I think it's time to start doing some light revision and building up to the exam, because as people have said, this exam is no joke, and to work after the exam you need to pass it, and I need an income, so this exam needs to get bodied. Also, you need to apply for qualified pharmacist roles in, I believe it's like end of January, start of February. So I need to start looking into that, preparing my CV and doing like some interview prep for when that gets a bit closer. It's also time for me to start writing more evidences, because I just find them so long to write. But you know, it's just one of them things that you just have to do and keep learning. Like, you learn so much on the job, it's a bit crazy. So I just need to keep that going into the next half of the year, and you know, I'm sure I'll be fine for the exam. But time is passing, so you know, I'm sure we'll all be fine, we'll all pass that exam. Also, let me know when you plan to start revision. Have you started already, or do you plan to start in the future? I guess revision for everyone is quite personalised. Some people like cramming, some people like to do a little bit right from the start. So yeah, if you're a pre-registration pharmacist, let me know when you plan to start revision. And the last thing I need to do, I guess, is pass this exam. Yeah, I think it's going to be quite a nerve-wracking time. So this year is the first year that it's going to be online. We won't be the first people to sit it. There'll be the pre-reggers before us, as their exam got cancelled due to the situation at the moment. For me personally, I'm quite happy that exams online. I think I prefer that. You just always work off a computer screen, don't you? So doing the exam with the computer screen, like, for me, I'm happy about it, but we'll see. Maybe if I'm struggling on the day, I'll be complaining, but either way, we move. Anyway guys, I hope you enjoyed the video. Let me know if you want to hear more about what I do as a pre-registration pharmacist. If you're a student or already a pharmacist or just interested, yeah, please let me know and I'll make more videos soon. I'll see you guys later.